Dr. Kirk Dimitris, and I'm an orthopedic surgeon at Orthopedic and Sports Medicine BayCare Clinic. I specialize in the treatment of chronic hip and knee pain. I did a fellowship in the treatment of chronic hip and knee arthritis, and I do everything from non-surgical to surgical care. And we offer treatment with conservative care, everything from physical therapy to injections, all the way up to hip and knee replacement surgery, which is our main focus. In our clinic, we are happy to see any patient, but the most common patients that I see are adult patients with chronic hip and knee pain. Whenever I see a new patient, I like to spend extra time with them and take a full history, find out exactly what their problem is, how long they've had it for, and how badly it's affecting their quality of life. My philosophy in treating patients is first to treat each patient like a family member. I like to form a personal connection with each patient. In general, when someone sees a physician, they may assume that the physician can understand their problem and properly take care of it, but I think it's important to make a personal connection with each patient. In my career, I've found it very rewarding to improve patients' quality of life, both by decreasing their pain and improving their mobility. And it's especially enjoyable to see those patients out in public. In my free time, I enjoy automotive repair, restoration, and racing. I enjoy running and doing triathlons, and spending time with my wife, Dawn, and our 5 children.